Living in Alberta is fun. There's always something to look into. So you know how the UCP government rolled out their COVID-19 program for vaccinations, now turning it into a business where they can make money? I caught this little snippet on the news yesterday. Please hold.
This will be the first year the province will be responsible for paying for the vaccine. The number of doses that have been wasted is too hard of a financial pill for the government to swallow. The minister cited the National Advisory Committee on Immunizations, or NACI, recommendations, which say certain groups in the high-risk category should get the vaccine, which they are covering, while others may get the vaccine.
NACI themselves have made sure to say that a targeted approach, they are not recommending universal access to COVID vaccine. And so we are doing that. We're doing a targeted approach. When we look at 2 years ago, roughly about $135 million worth of vaccine was thrown out just in Alberta alone. Last year, it was $44 million worth. We can't afford that. So by having a targeted approach, we make sure that those that are most at risk of adverse effects actually have access to the vaccine.
So this is the first year that the province is going to have to pay for it. Before, they didn't give a shit. It was the feds paying for it. And so in their minds, there was a bunch of wasted product. Money just thrown down the drain. Maybe if the government did a better job of promoting the fact that vaccinations work, there would be an uptake of people wanting the vaccination. And I agree, $44 million is a lot of money to throw away. But it's half the amount you spent on that fucking Tylenol. It's sitting somewhere in a warehouse down the drain. But let's get to the should versus may. This comes directly from NACI's website. It says healthcare workers. Remember when the UCP was going to make healthcare workers pay for their own vaccination, but then had to change their mind because unions said, why? It's a job risk. I guess they weren't really following NACI at that point, but all of a sudden they're following. Now, when we're talking about recommendations for vaccinations, NACI indicated the people that should be getting the vaccine. Doesn't mean all of them are gonna. But based on their conditions, history, they should be getting it. Other people may get it. That means that they aren't excluded from the ability to get the vaccine. The UCP has then interpreted that as they don't really need it. Spoiler alert, everybody needs it. Because if you go and read the entirety of what's on the NACI website, which is under the Government of Canada, efforts should continue to be made to ensure consideration of the needs of diverse population groups based on health status, ethnicity, or culture, ability, and other socioeconomic and demographic factors that may place individuals in vulnerable circumstances. Everybody is in a circumstance where there could be exposure. And considering the toilet in which we find our healthcare system, providing people with an ability to protect themselves from adverse effect of COVID-19 is probably something this government should be considering. See, this is where they say may, meaning they can. Not that they should, but they can. They're not excluded. But one thing I want you to take a look at, NACI has recommended that individuals from First Nations, Métis, and Inuit communities also should get the vaccine. When I look at what the government of Alberta has put forward for those who are getting it for free, I don't see that population listed here. This is it. And then the rest of us paying $100 administration fee. I think a lot of people need to take a look at this bullet. People with underlying medical or immunocompromising conditions. Because the UCP has outlined what that means. Voila. But there are a lot of other immunocompromising conditions. Sometimes people don't know they have an immunocompromising condition. Like maybe they don't know they're a diabetic, or that they have Crohn's, or MS. But boom! They get COVID, and the underlying condition they didn't know about because they can't find a fucking doctor puts them in an adverse to having COVID, which could cause them to wind up in a severe condition in hospital. Why not be proactive? Let everybody be able to get it without putting a financial barrier in place. And LaGrange likes to talk a lot about wastage. A lot of the vaccine was wasted. But a former CMO explained that the wastage issue has actually been resolved for this year. There are single doses of the vaccine. Before, there were multiple use doses, which means if they weren't used in the appropriate amount of time, had to be dumped. But single-use dosages, that's a hard word to say, are a one per person. There is not going to be any wastage because it's one per person. Now, LaGrange goes on to say that everybody has to assess their situation differently. It's going to be based on the needs of them and their family. But if you are living with someone who is a healthcare worker or any one of the other people that should be getting the vaccine, you are still at risk and you're going to have to pay for it, which again could be a financial barrier for people to get the vaccine. But let's take a look at what's happening in other provinces. From our neighbors in BC, there is nothing on their website restricting who can get it or charging people for it. Saskatchewan doesn't have a lot of information, but it should be coming. The point is, they haven't gone out of their way to make it known that people are going to have to pay for it. I mean, we know the government of Manitoba is going to be giving it out. Thanks, Wob. Oh, they also included First Nations, unlike Alberta. Ontario, annual COVID-19 vaccines are approved and free of charge for everybody. And Quebec, because I know how much Danny loves Quebec, free of charge, the flu and COVID vaccine. So it really makes you wonder. All the other provinces are going to have to foot the bill for the vaccine now. Why is Alberta making it cost prohibitive for people to get vaccinated? You know, because they don't believe in science. And they're so worried about spending money in places they shouldn't be spending it. Even though they do that all the goddamn time. Children's cold and flu, anybody? No? I guess we'll just store it. The bottom line, you can quote whoever you want to quote, Adriana. You are interpreting something and then implementing it by your interpretation. Everybody may get the COVID vaccine, but this province is making people pay for it. Oh, we're going to pay for it in more ways than one. Oh, by the way, she's not getting the vaccine this year. Shocker. Fucking turn up.